We did have some interesting ideas about whether or not there were some geographic wide of some sort connection between providers. You can see this on these green stickies here, connection between providers, so that we could generate a large volume of referrals that could go to a variety of providers in some sort of DPP providers in some sort of centralized way. On the TA and training and communities of practice, we also had some discussion about EMRs and how to best use EMRs as a source of referral, and went a little bit back and forth on whether that should be at the individual provider level or developed in a way that you capture a lot of eligible people and recruit from a group that's pulled from the EMR. And that led us to a discussion, and I think an important area of how do we get that data into the EMR? If we're not routinely screening, then you can't actually find the people with the A1C level. So we talked about how do we advance both, we advance the sort of routine screening, and whether there are some TA or community practice around routine screening, and or including, I guess, including quality metrics to sort of drive the importance of screening if providers and healthcare providers are measured in some way on whether or not they're doing routine screening. We also, for the community providers, identified a challenge in getting A1Cs, because you need them for Medicaid, but if they are not your patients, how are they getting the A1Cs to be part of it? So that was a sort of there's going to be some need for that from a systems level thing. And I'll offer anyone else in my on my group to offer anything. And then when we were talking about tailored communications, we have a lot of things here about physician champions and messaging in the community. And then we also had a conversation about promoting the value of community-based providers to referring clinicians who are then able to talk about why this is a good thing, that the healthcare systems themselves don't really know that DPP is a good is an important program, who the community providers are that they're referring to, and so on. So those were some of the things that we talked about there.
Thank you so much. The next group, our spokesperson can go ahead.
Hello, I'm the spokesperson for group 2. Regarding the conversation about funding, it looks like we were leaning more to a system approach where we can have a centralized place where information on DPP sessions are available, and different organizations can go to this site and just refer people that are interested in DPP, hand that information to them. Then regarding training we said that it's important that at every level in an organization or clinic space, people know what are the resources being offered, and providing the best way that people can join or just know more about the programs. And then regarding the tailored communications, I think that's, yes, we mentioned that there should be more connection between DPP providers to help connect eligible patients to a DPP program or cohorts that work for them. So this is all around start date, location, and language. So awareness across DPP providers on what is available across DPP can also help a patient make an informed decision on whether joining a group is the ideal thing for them. Did I miss anything?
I was just going to say, I think we thought of the physician and provider engagement, healthcare provider engagement as sort of maybe a systems level approach, and then the public-facing tailored communications more as a provider-by-provider approach, depending on the community they want to work with, so we can really tailor it to their needs. So I would just say that we differentiated the systems level for healthcare providers, but tailored communications for the community actually being reached by a specific provider. Great, thank you so much. Connectivity and referrals group, who's your spokesperson?
I am actually our spokesperson, just like Alyssa. So we had connectivity and referrals, and similar to the first group, we didn't really get into like a number amount as it relates to funding. We spent most of the conversation talking about this this concept between like linkage between like different systems and connecting the dots to leverage like and repurpose things that we've already done as it relates to like really setting forth how we want to build a solid infrastructure from a sustainability standpoint. So we talked about things like the like looking at the local ecosystem in Chicago and the participating organizations in DPP and putting them all in a NowPow community and letting them share resources via that linkage. We also discussed EMRs and the hubs and really looking at like what systems and how we can actually use like a solid infrastructure for that. From a training and TA / communities of practice standpoint, this came up more through like what activities are we missing, but the biggest piece that we're going to lift up here is training the organizations who are going to lead the DPP services how to speak the same language. So making sure like we really engage senior leadership in the programs and in all of our work so that everybody is saying the same thing across the entire workflow and the work streams, whether it's the people who speak to community members or the people who are thinking through the systems at the higher levels. Telecommunications was probably the greatest piece of our conversation to me because we thought through it through different lenses. So communications being building communications for those who are Spanish speakers. Also thinking through like how do we increase conversations between DPP providers. So for example, if we have a participant who speaks Spanish and we don't have enough providers who actually offer Spanish speaking services, like how can Erie speak to SUI and make sure that they're connecting and sharing resources as well. And then also we did kind of get into social media and some of like how that doesn't work and being more specific to like just like how is everyone communicating with each other, and then how does that look externally to participants. And then as far as like what activities are missing, we did kind of speak to like wraparound services and how do we create like a standardized system that does that carries most of these pieces. So whether it's referring to DPP or referring participants out to other resources that they may need to meet their needs, collecting data and seeing like what works and what doesn't work, and really using like the exchanges to see like what the gaps are from a systems level thought process. So those are like very high level pieces to what we discussed.
Great, thank you. And last but not least, Rebecca, the Quality Improvement Group, who's your spokesperson?
So it's myself, Siga, and I'm tag teaming with Angela on this. So in terms of quality improvement, I don't think we're saying anything new, but we definitely want to have like a systems approach to this of looking at quality improvement. So for the level of funding, we really want to provide funding anywhere from, we would say low end $3,000 to maybe $10,000 depending on the size of the organization to really develop systems within EHRs to automate that identification and referrals so we can really create something that's sustainable after that funding may no longer be there, as well as giving funding for billing platforms to have an easier way to get that sustainability piece rolling, as well as you need data for quality improvement, so giving funding for tracking within the EHRs. And then in terms of like the training and TA and communities of practice, we are looking at obviously quality measures for screening and treatment, so looking at what are the screening rates, what does the current patient population look like, who is being screened, who needs to be screened, and looking at tracking their treatment for DPP or metformin or whatever else to see, you know, how much of the population you've reached. And then really just having a common goal among all of the providers. And so, you know, we sort of talked about how with the vaccine, you know, there's a goal for 77% of Illinois to be, or Chicago to be screened. So looking at something similar to that, you know, X amount of people would be screened in Chicago or Illinois, and, you know, a certain percentage would be enrolled. So looking, you know, at a common goal. Also gaining commitment from large organizations or employers to really, you know, prioritize diabetes prevention. And then I will hand it over to Angela for the remainder.
Yeah, thank you. So a lot of the other post-its on here, in a way you can kind of think of this as, you know, sort of identifying and enrolling participants in the program, and then improving the metrics when it comes to engaging and retaining them through the program. So a lot of these are about, you know, how do you increase and can have a quality improvement approach to coaching quality through, you know, providing local assessments and mentorship. How do you ensure that coaches stay with your organization? Because not only is this an intensive program for participants, it's also a pretty intensive program for coaches. And, you know, so Sheila was sharing about like a tag teaming approach for coaches, or connecting the work that coaches are doing in the DPP with larger community health worker initiatives, so that this is not happening just in a DPP silo. Also, you know, identifying both coaches and curricula that are culturally connected and responsive is something that can help with retention. And then talking about training and ongoing training and technical assistance and sharing of best practices. We just touched briefly on tailored communications of, you know, some of these have already been developed, but how can we amplify those and sort of increase their value to the Chicago Cares Network. And we did not really touch on activities that are missing here, although maybe we covered those in our abundant post-its within the middle section. So that's all I have for my part of quality improvement.
Great, thank you so much. I am so excited about all of these ideas. You all have done a really great job giving us lots of things to think about. Any global comments after hearing from everyone that anyone wants to share about, you know, the possibilities for Chicago Cares going forward, or anything you want to lift up or reiterate that you heard from another group? All right. Well, so the final step here is we are going to be doing a ranking exercise. So we have put many of the, now these are sort of broad categories because they were based on the logic model. And of course, we didn't know exactly what would be said today. So lots of these are sort of put into a survey. And we'd like you to rank order what you think is most important for us as Chicago Cares to invest in now in Chicago, and then sort of prioritize down. So the highest ranked item would go to the top, and it's a drag and drop system. So I believe that's probably in the chat box already. I'm finding my chat box. There you go. So Rebecca, just with the survey, if you could all go ahead and open that up and spend a few minutes ranking these things. And if you can't finish it in the next few minutes, that's fine. We will use all of these sticky notes and all of the ranking to really help inform where we want to head and really think through the system. So we super appreciate this. This will help finalize parts of our year 4 work plan that were kind of up in the air based on all of the new context. It will help us solidify the specific scopes of work for some of our partners and training and TA participants, and hopefully engage and look for new partners to really build some of these systems. So we're super excited for all of these ideas. I know we'll be working closely with the Chicago Department of Public Health on next steps on specifically what this looks like. And we can probably re-engage you all. I don't want to guarantee any kind of timeline at the minute, but we will re-engage you all to let you know the outcome of all of this after today. So with that, Alyssa, do you want us to have any closing words before people switch to the survey and start the ranking process?
Just that I'm really grateful for everybody's time today and all of the creative thinking that what is going into this. And we're, you know, very excited to be working with all of you and many others in moving forward with new strategies and scaling this work over the last few years of the grant. So I appreciate all of the great thinking, and I'm sure we'll be turning back to all of you over time for more input or ideas or participation or collaboration on this. So thank you so much.
Thank you. So again, if you could take the remaining time until 2:30 to finish this ranking exercise in the survey. If you feel like you want to add a sticky note to a section of the Jamboard that you did not get a chance to participate in today, please do that today. We would like to probably close the Jamboard tomorrow, but if you have anything you want to add today, go ahead and do that. And then again, we'll let you know sort of outcomes of this in time. So thank you again. I'm going to stop sharing my screen and you can all go ahead and fill out that survey, and thank you. I just want to say, of course, you're welcome to jump off the call once you're done with the survey, but we again appreciate your time, and we'll talk to you all soon.
Janet won't let me submit. It keeps
Oh,
giving me an
really?
error. It keeps giving me an error message.
Uh-oh.
You have to
I
move
wonder if
every
that
one of the
other, I
categories.
wonder if you just fill in that box. I have the same problem.
I did that.
That still didn't work?
No, were you saying that you have to use all of the ones on the left?
Yeah, move them all over.
Yeah, you have to rank order all of them into, so if you don't care about something, drop it to the bottom.
Yeah, but then I gotta scroll over and hopefully it's not in the wrong place. I will figure that out. No, I can't figure it out. All right.
Sorry, hopefully you can get it to work.